Welcome back to Good Company. I'm Jordan Borders and I am on location at Illinois Eye Center. March is National Eye Donor Month, so I am joined by fellowship-trained cornea specialist Dr. Evan Pike to talk about corneal transplants. A little fun fact for our viewers out there, over 40,000 people in the U.S. actually have this type of surgery each year. It's the most common and also one of the most successful transplant surgeries. So Dr. Pike, thank you so much for joining us.
Thanks, Jordan. Good to be back.
Yeah, it's awesome to have you back on the show. So tell us about cornea transplant. What is it?
To start off with, the cornea is the window to the eye, so it's the first thing that light goes through, and so clarity of that cornea also helps clarity of vision. Cornea transplants are ways that we can improve the quality and the clarity of the cornea based on if there's cloudiness or loss of the normal clearness of that cornea.
Okay, and so why would somebody need a cornea transplant then? What would happen?
With the patients that I see and the patients that I've done surgery on, the vast majority of these are going to need a transplant because of an inherited or passed down sort of disease from their family members. Nothing they did or didn't do to get that, but they were sort of inherited into that. It causes some decrease of the normal health of the cells of those of the cornea, which then ends up losing the clarity. Other reasons why people would maybe have a transplant would be injuries or acquired problems of the cornea that basically it loses the normal clarity and clearness.
Okay, and you perform a kind of a newer corneal transplant surgery called DMAC. Tell us about that.
Yes, for the past year I've been blessed to have the University of Iowa teach me how to do this procedure, because it certainly appears to be one of the better techniques for replacing part of the cornea. For people with a specific disorder, people who are good candidates, of course, we can actually just transplant a super thin layer of the cornea. So most of the patient's cornea stays the way it is, stays normal. They can enjoy better clarity of the vision and decrease risk of things like graft rejection and graft loss.
Okay, and so you mentioned somebody who would be a good candidate for that. Who would be a good candidate for DMAC?
Usually when I see these people, they're otherwise fairly healthy eyes. They potentially could have a cataract, which we also work with in and around the time of surgery, but most of the time they have this inherited disorder and otherwise healthy eyes.
Okay, and then after they have this surgery, what is their eyesight like after that? Is it 100% regain, or what's that like?
Actually, the visual recovery is very good. And many of these patients, at least studies have shown that they can obtain visions of 20/20 and 20/25.
Wow.
Whereas before they did not have that. So we certainly see that the visual outcomes are better with these patients, and they can regain that full sort of independence and clarity of their vision.
Okay, and so with corneal transplants then, who is a good candidate to be a donor for a cornea?
Anybody can be a donor, and the way that we all can help out sort of the tissue donation community is to usually sign up through your DMV when you do your license. You can become an organ donor. There's also a website with the Illinois Secretary of State that you can go on and be a donor if for some reason you don't have a license. So those are the ways that traditionally patients are identified as donors. And then of course patients then pass away for various reasons, and then they can determine if the corneal tissue specifically can be used for donation. Okay,
and then I think you mentioned before when we've interviewed that we actually have a local bank. Is that over in Bloomington, I think?
Correct. Yeah. Eversight is an eye bank that has a location in Bloomington. They have some other locations in the Midwest, but primarily I work with that eye bank and get the tissue locally. So we certainly see that most of our donors come locally. Sometimes we need to get them from some other areas in the Midwest.
All right. Well, Dr. Pike, thank you so much for talking to us today about corneal transplants. Viewers out there, if you'd like to learn more, you can head over to illinoiseyecenter.com, or you can also give them a call at 309-243-2400. And don't forget, they've got 2 convenient locations, one in Peoria and one over in Washington. All right, thanks Dr. Pike again for joining us.
Absolutely.
All right, keep it right here. We've got more Good Company coming up next.